Okay. A warm good evening, everybody. Can you hear me, all of you? Just let me know if you can hear me. Okay. I just wanted to connect on the exam night, and we'll just see how the pattern was there in today's exam. Just let me know if you can hear me and see me clearly. Am I audible? Yeah, I think, yeah. I can. Let me share the screen now. Okay. So we had a new exam this year, right? So there was a completely new content, new pattern was being discussed in this exam, and we had a 50 sets paper. And actually, good evening, Disha, Vandana, Bhavya, Rahul, Swankar, and I hope you all are doing good. Now, one thing that I can tell you is this exam, the new pattern has been a blessing in disguise for many students. Actually, many students said having a 50 paper sets were actually beneficial for them rather than the worry that was they were having that exam will be difficult because of the new pattern and all. Most students were happy. काफी students जब exam के बाद भी बात कर रहे थे कि during the break also and all, they found it actually very easy to review 50 questions. So most students felt that was a good thing compared to many students who said that who wrote the previous exam also told me that compared to the last year, this was a better when you have this sets of 50, this was better to review the questions and all. So that was one thing that was very positive and good sign that 50 sets paper is actually being liked by the students. And there was enough time to review those 50 questions. They were saying most of the questions were one-liners in the first paper, so they got enough time. So if you look at the paper analysis of this exam, right, first paper, the most students found it easy, actually easy to moderate, and mostly preclinical subjects were there. Time was sufficient for that. New pattern was helpful for time management. PSM weightage was less, but PSM had numerical questions. So in PSM, we had a lot of numerical questions here. In PSM, we had numerical questions. And the problem, some students told me that the calculator that they gave in the software, right, the multiplication thing was not working. And I think that was not fair when they give numericals and they give a calculator, and the many students actually told me after during the exam break that the calculator, the multiplication part was not working. So that is one thing. And compared to the subjects in the first paper one, anatomy was heavily tested and was pretty much doable. Then we had biochemistry, that was also very simple. Patho was less, but your pharma was heavily tested. Pharma was also again an important subject in your first paper one. There were a bit of micro, but pharma was more in that. Forensic, we had decent questions this time and very doable questions. So forensic was a scoring subject for students. So anatomy, forensic, pharma, these subjects, they found it really good. There were some few questions of the Aptal also that came in the paper one, and SPSM around 7 to 8 numericals. They said 7 to 8 numericals were there, and this was a thing that you all have to work. Even last exam also, many students told me that in PSM they were having numericals in that. And if you don't need the calculator and stuff, that was better only. If some students are saying that we didn't need the calculator for that, but some students out of the exam, they were telling that this was there. That was one thing. And a bit of PD also, right? So PD was also there in the first paper, and not very much, but manageable. So paper ones, most of the students were, happy about it. The time was sufficient and they were, satisfied also with that. So that's a good sign that, and these were mostly one-liners, right? So these were mainly one-liners and mainly previous year topics. So please, in your greed to study too much, you should not miss out on the, very frequent questions and expected questions. As far as paper 2 was concerned, paper 2, yes, this was on the moderate side. Especially surgery, many students found it very difficult. Actually, the topics, the way of asking the questions was different, and a lot of images actually. So it was image driven. So many students said a lot of images. So do give a weightage to all the future aspirants who are, listening to me. Please give weightage to the images that are there in your all your clinical subjects also. So paper 2 is heavily being tested on an image-based fashion also. So see that you do that well. And IBQs were much more, right? So roughly around 40 to 50 images must have been there. Okay, 40 to 50 images must have been there. So that image-based questions very important for you. And overall analysis, I would say the easy to moderate. I can't say easy completely. Actually, I think it is more moderate because of the paper 2, more moderate. But still, I feel there will be a good score rate in the paper 1 for most of the students. So, and that should help many of the students to clear the exam. And PYTs were helpful. So important to do the one-liners also, the previous year topics also. And the good thing is new pattern, right? So new pattern that was helpful for this. And I'll also share you few of the questions that were asked in this exam, especially with the subject of radiology. So the centers and all were more comfortable this time. People said there was like better facilities, but some students complained that while clicking the mouse, right, multiple times they had to click the mouse, and also small issues for some students, but overall it was a well managed session. Paper 1, most students were very smiley and happy, and paper 2, they had a confused look on their face. So I think, but overall, okay, exams are supposed to be like that, and I hope by the average of both the papers you should do well. And coming to radiology questions, radiology was also heavily tested in this exam. We had some standard 10 to 12 questions in radiology also. There was this nuclear medicine question. So this was something that I taught you in your classes also. This PSMA PET is used in. So PSMA is prostate specific membrane antigen. So if you look at the trend of the exam in radiology especially, they are giving weightage to nuclear medicine, right? And last time also we had a question on 18-FDG. This year also we had a question on 18-FDG, asking it is based on glucose metabolism or the isotope used, right? That was there. PET-CT image identification was there. And they asked you about air and right hemi diaphragm. These are standard emergencies that you should know. And some routine questions like miliary TB, everybody you must have been knowing. And this topic has also been repeatedly tested. Most radiosensitive tissue, most radiosensitive organ, right? So all of these table that you study about radiosensitive tissues. And last year they asked you about the most radioresistant phase of the cell cycle. This year they asked you about the most radiosensitive organ. They asked you about the banana sign, and in banana sign, instead of saying Chiari malformation or spina bifida, they asked you about banana sign is seen in. There was an image also. There is neural tube defect. A triple bubble radiograph was given, right? That you study in your GI. That is jejunal atresia. And this 𝗬𝗲𝗵 scan is something that is very frequently tested. So look at the number of questions we got in nuclear medicine. So in radiology, nuclear medicine was heavily tested. So losing out on one such chapter, not doing one chapter, right, would not be an ideal way. Try to see that you cover all of these, and these are standard questions, right? Many of you must be knowing. This is one question, this is one question, this is one question from nuclear medicine, like this is one question of nuclear medicine. So totally 4 questions only from one chapter, right? So very highly tested in this exam. So important one. There was some overlap with orthopedics and also your surgery and surgery and other subjects. We had osteosarcoma, Codman's triangle given. We had segment 8 of the liver asked. There was one image that I'm trying to get a final, image and the options, right? So there was something called percutaneous transhepatic angiogram or biliary drain. I'll look into that. So pretty much, I feel scoring radiology was scoring, right? PSMA PET for prostate, PET-CT image, isotope used in PET scan. This was asked in the last exam also. If you remember in your last exam, also the same isotope was asked, and that was pretty much doable. So I think as far as radiology was concerned, this should give you some scoring advantage, right? And I hope most of our students have done well. Keel X-ray, I think that was, I have not got the exact image. I'm looking for that, but I feel that was the Codman's triangle. But exactly, let me look into the options that may be available, right? And some advice to all the students. Now, enough of hard work. Okay, I see students staying back and waiting for the results. They are not going homes and stuff. Exam is, over, right? Now, there are many things in life to be done. There are, family, there are relatives, friends, and all of them are equal part of, your life. So exam is important. So is your family. So is your, other things also. So it's time to relax, time to connect to all our people, go back to your family, go back to your, people, reach out to your friends, spend some quality time, relax also. And don't be too over analysis. We'll release a recall PDF of all the 300 questions that we will try to see as close as we can get. We are collecting all the questions, and hopefully by the time we get all the questions, we'll release a arise recall like we do every time. And hopefully that should give you a rough idea about how the direction is going, and you can plan out for that. And hopefully result will also be pretty much soon, in 20 days or so. So till that time, don't unnecessarily spoil your like free time. Actually, this is free time. Even if you clear the exam, once you join your internship, you'll have very less free time to spend. So this is a very good phase that you will have to really, really relax and meet your family, meet your friends. I strongly suggest you to make the best use of it. You have done your best. You deserve a break, right? And hopefully, we'll all meet with some positive results once the results are announced. And anything that you would like to add on to? How was your experience if the students have, written the exam from their side? How was your overall experience? How many of you feel that the new pattern is actually helpful? How many of you actually feel, just click in the chat box if you can really say if the new pattern was actually helpful for you all. How many of you felt that the new pattern was easier, right? So I think many students actually were very happy after the exam, especially in paper one, after paper one, and I think the results will be good enough only. I'm very positive about the results, so should you all be, and take a good break, needed break, and I'm sure you'll all be successful and happy on the other side. Okay, so I feel it was a decent exam, and all of you worked so hard. Needed break right now. Okay, needed break right now, and we'll meet up for further discussions, and we'll meet up. Okay, it gave me time to focus on 50 questions. Yes, that was new. Loved the new pattern, right? That was nice. So yeah, so I think that should give a lot of hope to future aspirants also, that this pattern is actually beneficial and working out also. It all depends. Yeah, paper one was fine. I think paper one was pretty much doable. Hope for a good average also, right? So good average pass percentage also. So no pressure. I have to concentrate on. Yeah, many people were saying that that kept them active also. After every block, it kept them active also. It was not like a long session, right? So every 50 questions, right? Once the next block starts, it is like a new start for them. So that kept them active throughout the exam also. So that was also a good change that happened because of this exam. So I'm also very happy about that change, and that actually worked. Instead of being fearful about it or worried about it, this was actually beneficial in the practical exam, right? So stay hopeful, and best wishes from my side for your good exam. And not easy, I agree. Yes, it was a moderate paper. It was a moderate paper, and tricky questions, especially in your clinical subjects. Especially surgery was one subject that bothered students a lot. And I still feel, because the paper one was pretty doable, many students will score much more than the average scores in paper one, and that will help them in their paper two, right? So let us be hopeful, and wish you all a good result. And please take break. It is important to take break. Do not stay back. Do not unnecessarily stress yourself. Connect to your families. They're all important things to do. Very necessary break. Connect to people, watch some whatever you want to watch, right? Some web series, movies and stuff. Any good movies you want to. So many images. Yes, images have been tested heavily, and in radiology, 9 out of 10 is a very good strike rate, and that should definitely cover for your some mistakes in other subjects also. Okay. I'm glad, Kishore, that you answered most of the radio confidently. Okay, surgery image-based questions have been heavily tested. Yes, I agree with that. Okay, and let's be hopeful. And I'm very positive also with what I could I gather from the students. Right, I could sense that many have done well, and they'll do a good exam. Okay, chalo. Will not take much time. Exhaustive, long day for you all, and let's be 9 out of 10. Really nice, really nice, and hopefully, we'll all please message once you get your results. Okay, so I'm sure that you all will pass the exam, and do message when you're scoring so well. And I'm confident also that overall your results will also be good. Okay, stay blessed, and have a necessary break, guys. Okay. God bless you, and do inform after your results. We'll be all waiting eagerly to hear from you, about your results, right? So best wishes from my side. Stay positive and don't panic. Crucial holidays, I would say, this time before your internship starts. Again, a hectic time and all. Enjoy this holidays. Okay, enjoy the break. Stay blessed, guys. Take care. Good night, all of you.